Good morning, good afternoon, good evening to wherever you are. My name is Vikram Patel, and I welcome you to this webinar. I am the Paul Farmer Professor and Chair of the Department of Global Health and Social Medicine. The webinar today is hosted by a number of different components of Harvard University, the Lakshmi Mittal South Asia Institute, in particular, our New Delhi office, the India Research Center of Harvard Business School, the India Research Center of the Harvard T.H. Chan School of Public Health. In addition, a co-sponsor is the Lancet Citizens Commission for Reimagining India's Health. Once again, welcome to you all and welcome to my panelists. Let me frame the context of this webinar. One of the most important lessons that has come from science is how the environment that we live in are in a constant dance with our minds and our mental health and well-being. Put simply, this means that our experiences influence our feelings. By experiences, I mean the experiences in our social world influence our feelings, our thinking patterns, and our behaviors, what constitutes our mental health. And our mental health, in turn, influences our environments. It's a constant dance between our environment and our mental health. Now, after completing education, the workplace is surely the single most important environment that adults will find themselves in. But the workplace isn't just one homogeneous thing. Oftentimes, when we hear conversations about workplace mental health, it is heavily biased towards the kinds of workplace that people in high-income countries might find themselves in. Mostly institutions of various kinds. However, in India, work can mean very many different things. For example, more than 80% of our population would be considered to be self-employed, a large proportion of whom would be either daily wage laborers. The gig workplace is a completely new development. So that the formal workplace, for example, being an employee of an institution, is actually only a minority experience. This webinar then will address how the very different kinds of working conditions that people in India might find themselves in affect mental well-being. We will also explore practical ways to support employees in these diverse workplaces and highlight inclusive strategies for promoting mental health in both formal and informal workplaces. Today, I'm joined by a truly distinguished panel of experts from these very different sectors. What we're going to do is we're going to have a round of questions that I will pose to the panelists, as well as the panelists posing questions to one another. The purpose of this opening session will be to frame the issue, to summarize the evidence, and by evidence, we'll be taking a very broad understanding of evidence, not just the evidence that comes from science, formal studies and experiments, but also the very important evidence that comes from experience in the workplace. And then for the second part of this webinar, we're going to entertain questions from you, the audience. Now, just a word for housekeeping for those questions. We will be inviting you to submit your questions in the Q&A section of the Zoom window. And as those of you read other people's questions, if you feel you want to vote for one of those questions as something that also is relevant to you, please just use the vote button, and so that we will see those questions going higher up the priority order. And this is, of course, just to make sure we ask as many questions as possible in the time that we have available. So I'm going to kick off now with our first panelist. And I'd like to introduce my friend and colleague from many years now, Dr. Shekhar Saxena, one of the most important figures in global mental health. Dr. Saxena is a psychiatrist. He served as the director of the Department of Mental Health and Substance Use at the World Health Organization, prior to which, in fact, he was a psychiatrist working at the All India Institute of Medical Sciences in New Delhi. Over the last phase of his professional career, he was a professor of global mental health at the Harvard Chan School of Public Health. Shekhar is a global leader in advancing mental health policy, systems, and services, and has shaped international strategies to make mental health care accessible and inclusive. He loves traveling and collecting graffiti photos from the various places he visits, one of which is, in fact, the United States, which is where he is joining us from. Shekhar, welcome to our panel and thank you for joining us. I'd like to kick off by really asking you about the big picture. You've been at the center of so many initiatives through the World Health Organization and at Harvard that are concerned with the high level questions around what shapes our mental health, how we measure it, how we define it, and more specifically in the context of the workplace. And I'd love to hear from you about your messages regarding this high level picture.
Thank you very much, Vikram, and good morning, good afternoon, and maybe good evening to the listeners. Vikram, you asked a question about the mental health at workplace, which is the topic for this webinar. And I just want to begin by emphasizing that we are talking about mental health and not mental diseases, which is a common misperception that we are dealing with only those people who have a disorder or a disease. In fact, we're talking about all of us and all of you listeners, because we all have mental health as a positive or not so positive a dimension. We are all on a spectrum between uh, good mental health and perhaps not so good mental health. And so we are talking about all of us. We are also talking about mental well-being, which is how WHO defines mental health, a state of mental well-being and not merely the absence of disease. In fact, WHO definition goes further to really say that it also is about how we cope with our day-to-day routines in life, at the school, at work, in the families, and so on. So it's our capacity to really cope with the normal stresses of life. And taking that kind of concept, a very broad concept of mental health in mind, we're talking about people at the workplace, which involves all of them. And it involves their mental health at present, but also in future, because it varies with time. And so we are talking about mentally healthy environment and in the workplace, which can be healthy or which may not be so healthy. Let me also say that workplace is not only a source of stress for many people, but it also has very many positive dimensions. For example, we are experiencing a lot of positive things about work. It gives us identity, it gives us a purpose in many cases, and of course, it gives us economic security. And all of these are positive. So let's not disregard that. And of course, workplace can give us more positive things, or sometimes, unfortunately, more negative things, which are in the form of stresses. And all of that in aggregate. Sorry, my grandson is around, so an interruption many times. So we're talking about aggregate. Sorry for the slight interruption. So we're talking about the positive and the negative things, which can all impact us in a variety of ways. Another thing which I want to specify is that mental health is all together with us. We bring our mental health stresses from home to work, and we also bring them back. So it's not that mental health at workplace is something very specific. It's just a component of our mental health in general, which again changes as a dynamic across the time, so that what we experience today may be very different from what we experience tomorrow. Uh, Deriving from all of that, I have 2 points to make. One, that mental health at workplace involves all people at the workplace and not only employees. It includes the management, it includes the top leadership, as well as the employees at the lowest rung of the organization. And here I'm talking mostly about the organized sector, although I know that many of our panel members are much more experts in the unorganized and semi-organized sector, so they will speak more about that. It involves the leadership, it involves the employees, and in fact, it involves the largest sense of the family that organizations have. And the second is that it involves all of us. So it involves promotion of mental health, protection of mental health, because there are many things in the workplace which can actually be potentially harmful to our mental health, but it also prevents mental health problems from growing. And eventually, of course, many people at the workplace will have a mental health symptom or even a disorder. So it involves the care and sometimes treatment of problems that might be there at the workplace, originating from workplace or otherwise, because even many of the countries have a stipulation that employers should not discriminate in employing people who might have a mental health problem, and that includes India actually, because mental health disability is one of the kinds of disabilities that are mandated by the government for employers to employ people with mental health disability. So adequate care and adaptation needs to be provided to the people so that they can work in the best possible environment. I'll end with just listing a few of the unhealthy work environment factors, at least in organized sector, that can influence the mental health of people. The first is the workload and the compatibility between the skills of the person and the requirements of the job. And many times there is incompatibility, which leads to mental health problem. Then there is the mutual respect amongst the employees and between the management and the employees. There is the control over aspects of work. If a person has less control, or at least less perceived control over the work environment, then mental health can be impaired. It's also about timely and accurate, helpful feedback to the employees. How are they doing? If the feedback is inaccurate, not timely, or in fact deliberately misleading, then it can certainly affect mental health. It's also about the incentives, monetary as well as non-monetary incentives. And finally, support from colleagues, including from managers, that is critical for the mental health of employees. I'll deal with the measurement aspects later on, perhaps in the webinar, but these are some of the broad things which affect mental health of the at the workplace, and how the organizations can engineer their workplace in a manner that can actually be more protective and promoting the mental health of all of the part of the family that the organization belongs to. Thank you, Vikram, and back to you.
Yeah, thank you, Shekhar. I can see that your mental health was very bolstered by your grandson, and that just reflects one of the ways in which our environments, and that by that I mean our interpersonal environment, which I think is a very important place, a part of the workplace, isn't it? I mean, it's not just we're not talking about the physical space, which is of course also very important, but also the social and emotional space that occurs in a workplace. And I'm sure we hear more about that. I think I wanted to just flag up a few things that you said that we need to keep in our minds as we proceed. The first is that we're talking about mental health and well-being as a positive state here, not just the absence of mental illness, although of course that is also an extremely important goal in and of itself. We're also recognizing that workplaces could be places of healing as much as they could be places where things can go all right. So we need to think of the workplace as an opportunity, in fact, for promoting mental health and well-being. And then finally, I think another key thing you said is that everyone plays a role. And I think this is important to recognize not only the agency of all people in the workplace, from the person who has the least control to the person who has most, but also that the workplace can affect everyone regardless of where they are in the hierarchy of the workplace. Let me now turn to our second panelist, Dr. Geeta Kumar. Geeta, welcome to the panel and thank you for joining us. Geeta is a well-being and sustainability advocate, and she's a coach and a DEI and OD consultant, facilitator, and researcher, professionally with 30 years of professional experience. And what I love about Geeta's bio is that she is a practitioner, and her expertise comes from direct experience of diverse workplace well-being initiatives. She has a very eclectic and diverse set of interests, which I'm sure we're going to hear about. She tells me that besides being a human parent, she adores being a pet parent and a plant parent. She loves stimulating conversations, solo travels, is a foodie to the core, and enjoys moments of recharge with a good book. She's joining us today from New Delhi. And so, Geeta, my question to you is, what are the unique challenges faced by gig workers and by formal organizations? And I was particularly interested in these contrasts. Gig working becoming such a dominant kind of employment for young people entering the job market. Gone are the days when people like me were entering the job market, when almost all of us were seeking secure long-term contractual employment. That is no longer the normal employment situation. And so we'd love to hear your thoughts about your experiences with these two very different kinds of workplace settings in terms of the challenges and possibly the opportunities. Geeta.
Thank you so much, Vikram and the Mittal Institute for bringing such an important and relevant topic for discussion. Hello, everyone. Let me actually begin before we step into the challenges to understand the lay of the land and the fast changing workplace, work, and most importantly, the workforce. Uh, and as Vikram and Dr. Saxena has already mentioned, that all these inform how people feel, how they act, how they behave, and therefore how it impacts their overall mental health and well-being. And there is a huge complex dependencies and interconnections between individuals, teams, and the overall organization. So if you look at the workplace, it has undergone huge number of iterations and changes. And currently we have work from office, we have work from home, we have hybrid and all in between as well. If you look at the workforce, this is the only moment, first time in history, when we have four generations. It's a multi-generational workforce, and we have a Gen Alpha, which is knocking at our doors, ready to enter the workforce as well. So it will be five generations very soon. There are various forms of employees. You have full-time, you have off-roll, you have flexi, you have gig. There are unique challenges of the vulnerable and the marginalized people, women also, the people with disabilities, the non-binaries, all of it impacts the well-being and the mental health of people. If you look at the work, there is uncertainty, there is ambiguity. It seems to be moving very, very quickly. There's a huge pressure and demand to keeping on reskilling and keeping on remaining relevant. The learning curve is shortening. Automation seems to be a boon and a bane. And as Dr. Saxena said, there is a realignment to one's equation with work itself, and our own connection to that self-worth, identity, expectations from work, life, and so on. And this all impacts our relationships. It impacts our connections. It impacts the camaraderie, the psychological safety, and the sense of belonging. If you look at the aspects of mental health in the Indian context, because we are a very unique continent and a country, and there is, as already been mentioned, individual, there is family, there is society, there is teams, there's environment, and there are organizations. Unique to Indian context is also this very under-addressed area, which is caregiving for child and elder care. And it definitely impacts how individuals deal and show up at work. So workplace stress, anxiety, deadlines, these are all things that we as consultants encounter. The job security, financial stress, harassment, including sexual harassment. Women and biology is a very big one, starting from menstruation to menopause, sleep disorders, substance use, including rampant use of performance enhancing stimulants in the workplace. Having said that, what does the data reveal? Data reveals not a very positive outlook. India tops the global charts with 59% of employees reporting burnout symptoms. India in 2021, and this is going higher, witnessed a record 1.64 lakh suicide, many of which were work related. Deloitte, since 2019, so for the last 6 years, has been tracking uh, and trying to gain mental insights on the mental health, particularly of the Gen Z, the millennials, and women. And they find the same stress, anxiety, burnout among the Gen Z and the millennials. Women are struggling to switch off from work. They're not able to share that they are struggling. There is a huge amount of guilt not doing enough for the family or the home. And besides that, all shame and stigma continues. Taking time off from work for mental health reason has still poor acceptability. While we are saying that, evidence also shows that mental health directly impacts business outcomes, and poor mental health leads to decreased productivity, increased absenteeism, higher turnover rates, significantly impacting the company's bottom line. In fact, the World Health Organization estimates that India will suffer economic losses of $1.4 trillion between 2012 and 2030 due to mental health conditions. And that's not very optimistic. This is just the organized formal workforce. Now let's shift the lens to the gig workers. They come in various shapes and forms. Gig workers encompass a wide range of skilled, unskilled, engage in short-term projects or on-demand, traditional, and they are different from traditional full-time, as Vikram was saying. And this could be not necessarily out of choice, but most often due to lack of access or opportunity for full-time work. They include freelancers, independent contractors, those who find work through online platforms, diverse sectors, transportation, digital services, creative fields. The mental health and well-being landscape for them is fraught with two very important concerning areas, which is uncertainty and lack of community. What we've been tracking, and this is again a very new area, very little work has been done to understand how we can support it. But typical issues that key mental health issues that gig workers struggle is stress and burnout, anxiety, depression, loneliness and isolation. This is a big one. Impact of financial insecurity, because this is again a very important one. Erratic income, lack of benefits, like health insurance, unpredictable work opportunities, and this causes a huge amount of stress for gig workers. Work life is a challenge, the monotony of the work, lack of social and institutional supports. Basically, this is the landscape. These are the challenges that we have experienced with data and what we see at the workplace. I hope that sums up the challenges and realities, Vikram, for now, and we can move on to anything later afterward. I'm happy to take questions later.
Thank you, Geeta. Thank you for really foregrounding, some of these very important concerns, some of which are actually true of all workplaces and some are more specific to the gig workplace. I wanted to just highlight a few points that I took away from your remarks. The first is just acknowledging once again the incredible diversity of working environments that people in India will experience, and some of which are associated with much greater levels of uncertainty. And that's one thing that we have seen from psychological science that really acts as an important guide here, is that one of the greatest sources of stress and poor mental health is uncertainty, not being able to know what tomorrow brings for you. And this is a huge contrast between formal employment and gig employment. If you have an accident, for example, the possibilities you may not even be earning for the subsequent days until you recover. So that kind of uncertainty. You mentioned another important piece, which is lack of community. And I think this is true, of course, of the gig workplace, but in fact, it could also be said is true of many other workplaces these days. And one question I'm hoping that you will address as we go to the round of solutions is how do you build community in these kinds of workplaces? Shaker, I want to add what Shaker said earlier about the lack of control, not having, and that again twins with uncertainty. This is another well-described psychological construct, the level of control that one feels about their life, which of course in many workplaces is outside the control of the average worker. And then I think another critical point you make, which is such a delicate one, which is the lack of a sense of intellectual stimulation and satisfaction with the work you're doing, which in this kind of modern industrial age is the least important thing for most employers. I want to end, and this kind of segues very nicely, I think, into our next panelist, and that is a unique vulnerabilities faced by women. You referred to actually a number of different kinds of vulnerabilities, for example, people with disability. But one of the themes that recurred was the notion that women in the workplace have very particular vulnerabilities. For example, you mentioned caregiving, but actually the truth is that's a euphemism for women because most caregiving in India is being done by women. So I think the questions about women in the workplace, the fact that they are underrepresented, the fact that there is a very patriarchal system in the broader social world that also permeates the workplace. These also have potentially specific vulnerabilities for women themselves. So, with that, let me turn to our third panelist. And I'm delighted to introduce another friend from a long time, Mirai Chatterjee. Mirai is the leader of Seva, this globally renowned collective that was started by Ilaben in Ahmedabad, where she heads the Social Security team and chairs the Seva Cooperative Federation. She was formerly Seva's General Secretary, and she has an illustrious global and national record of service, including the World Health Organization's Commission on the Social Determinants of Health and India's high level expert group on universal health coverage. She currently chairs WIGO and is also part of two Lancet commissions, including the Lancet Citizens Commission, which is co-sponsoring this event. She's a graduate of Harvard and Hopkins and has also been a member of the National Advisory Council appointed by then the Prime Minister of India in 2010. She tells me she loves gardening, which she finds very healing. She's joining us from Ahmedabad today. And so, Mirai, the question to you, given this incredible long history that you've had of working in one of the world's most renowned collectives of self-employed women, I wanted to ask your thoughts about how this particular workplace context, which I guess some would characterize as being informal, although it is also a formal workplace, how does this affect mental health? And I wanted you to also maybe touch on the more specific issue of gender and how there's an intersection between gender and these shifting workplaces. Mirai.
Thanks a lot, Vikram, and greetings to all our listeners. I'm delighted to be part of this panel, and thanks to the Mittal Institute. Now we change to the world of work of the informal economy. And as you mentioned in your opening remarks, it's almost everybody. In fact, 93% of the Indian workforce is informal. And if I speak of the female workforce in India, it's more than 94%. So it's everybody almost, as I said. And we don't have any central workplace where we all come together like on a factory shop floor or in an office. Although in factories and in offices in India, there are a lot of contract workers who are informal. But for the most part, our workplaces are rather diverse, to say the least. They are in our markets and bazaars, they are in our fields, they're in our forests, they're the seashore, they're the streets of our cities where our sisters and brothers collect waste, recyclable materials for a living. And they are in our homes. The largest number of women informal workers are home based workers. Their homes are their workplaces. So, as you can see, there's a lot of diversity and also a lot of shifting. I may be a farmer today, a woman farmer, but in the lean season, I become a construction worker or a domestic worker or some combination thereof. And we found over the years in Seva that actually for survival, informal women workers do multiple economic activities, as many as 3 or 4 at a time. So you can imagine what that does to one's mental well being. Also, needless to say, particularly informal women workers are the most vulnerable and the poorest of all workers. So there's an overlap between informality, poverty, gender, and also intersectionality. Most of the informal workers, including women, of course, belong to the most historically disadvantaged castes and communities, ethnic and religious minorities of our country. Further, as has been mentioned by some of my co-panelists, they do not have regular work and income. In fact, their entire lives are a quest for regular work and income, and they face insecurity of work and income. Tomorrow I work for you, tomorrow there's no work for me here. There's shifting work. Oftentimes I'm not paid. There's exploitation. There's cheating. So there's, trust deficit as well. So these are the kinds of things. And of course, if there's insecurity of work and income, then there's food security. There's not enough food to put on the table for families of informal workers. In addition, social protection, there are huge gaps. There have been some improvements like the Pradhan Mantri Jan Arogya Yojana, health insurance, but it does not cover all informal workers. So generally, there's a lack of social protection. Childcare has already been mentioned. We do not have universal childcare in this country. And for women, it's not a choice. There's no question of burnout. They have to keep working for survival and to feed their children and to send them to school and to have some modicum of healthcare and other basics of life. So no social protection, meaning healthcare, childcare, insurance, pension, roof over their heads with basic amenities like a tap and toilet. Still, many of our sisters and brothers don't have toilets, and that's a big stressor, particularly for women. So these are some of the issues. And plus, lack of labor laws, policies, appropriate policies, these kinds of things also are faced by informal workers. One more thing which is particular, well, more particular to women workers, but it may be also there for men workers, is sexual harassment at the workplace. Our sisters often report to us that they have to provide sexual favors for work, which is scarce. So if they want work and some income and to feed their kids, they have to provide these kind of favors as well. So you can imagine all of this create what it does to one's mental health. And on top of it, there are very few unions and cooperatives and solidarity organizations representing the workers, where they have voice and representation, where they can get services, access to services, and a support system as well. So frequently, informal workers, particularly women, are atomized in their homes, or they just don't have any support. They do have family support, of course, some of them don't. So these are some of the issues. I'm afraid it isn't a very cheerful picture, but when we come to the interventions, there is a lot that we can do and we can do together. Thanks, Vikram. I'll stop for now.
Thank you, Mira. Mira, you know, the thing is, you've reminded us of something that has always been of concern to me is how, the conversations about the workplace are dominated by, as it turns out from the figures that you presented, a relatively small minority of people in India in the workforce. I remember in the COVID pandemic, I was often invited to run webinars for people in different companies who were now working from home. And of course, it struck me later on that actually this was still an important segment. Everyone matters. But somehow no one is inviting me on a webinar and the mental health of people who were forced to work when everyone else was sitting at home. And it's exactly the kind of, the workforce you described, those who are providing essential services, who still had to continue to provide those essential services, but even without the kind of security of income and so on that you describe. And I always remember the harrowing images of so many millions of people having to return home because they were suddenly thrown out of work and they had no security of any kind. And so you're absolutely correct to point out that this is a very unique and a very large proportion of India's people who face intersectional kinds of vulnerabilities. I want to remind our panelists actually where this ties in with the science. In fact, what the science shows us, and I'm going to refer here to the National Mental Health Survey of India the largest survey ever conducted in this country involving more than 30,000 adults sampled from around the country. It was sponsored by the Ministry of Health and Family Welfare. And they found that the most common mental health conditions like depression and anxiety and trauma related conditions were 2 to 3 times more common in women than men. Actually, this is a finding that you see in most countries, but it's certainly also very true in India. So you should pause and reflect on this. These common mental health conditions are 2 to 3 times more common in women. And one has to ask whether the very different social worlds that women inhabit in India are contributing to some of that increased risk. And the second thing that the survey showed is people who are in the poor, that is to say, the lower income groups, had a double increased risk of suffering from these same conditions. In other words, up to a certain extent, of course, having wealth is a positive mental health protective factor. So I'm sure we'll return to some of these themes. I also wanted to just remind ourselves that not only is this informal workforce one which has no security, often has no central workplace, but I also think this idea of multiple workplaces. We often think of individuals having just the one workplace, but as we know in India, many people, I don't know what proportion, but many people hold multiple jobs in order to actually put food on the table. So thank you, Mirai, for grounding us in recognizing these very diverse spaces in India. Let me turn to our last panelist. This is Professor Kirti Sharda. Welcome to our panel and thank you for joining us. Kirti works at the IIM Ahmedabad, where she specializes in leadership development, self-awareness, and psychological well-being in organizations. She's very well known for her engaging and insight-driven sessions. She's committed to nurturing personal growth and emotional wellness in professional settings and shaping leaders who can lead with clarity, compassion, and intentionality. She tells me that she loves cats, who she claims are the ultimate Zen masters. We can agree or disagree with her, but I think she's probably got a point there. So, Kirti, I wanted to just turn, you work in one of India's most prestigious business schools, really. And this is a school that really churns out people who are going to be corporate leaders. But the school itself is a kind of system where students who have worked so hard to get into IIM Ahmedabad enter the school. And this is so similar to other institutions like hospitals and universities. And I wanted to really turn to your experience of working in a higher educational institution and understanding a little bit better your observations about how the institution, these kinds of institutions, can shape the mental health needs of everyone in there, of course, students to begin with, but also you may touch on those who are working in those institutions.
Sure.
Kirti.
Thank you, Vikram. I would like to begin with the story. And last year, a very brilliant student walked into my office after the summer internship process. Let me call her Amna. Amna had secured a prize placement at a top-tier company, something her peers and families had dreamt of for years. Yet, as she sat across from me with tears in her eyes, she said, "I know I should be celebrating, ma'am, but I feel like I'm drowning. What's wrong with me?" And Amna's story is not unique. It is the story of countless young adults navigating the invisible architecture that shapes our mental health, an architecture that can either nurture us or can devastate our psychological well-being. My dear colleagues and participants, in this conversation, I want to bring to our awareness this invisible architecture, which spans family expectations, work pressures, and organizational cultures, and explores how the very institutions meant to support our growth become sometimes the source of our deepest struggles. Think about this for a moment. We spend our entire lives within institutions, from the moment we are born into our families, through our schools, our college years, into our workplaces, and even into our communities of faith and culture. These institutions are not just physical spaces, they are psychological and emotional ecosystems. They shape how we think, we feel, and how we relate to ourselves and to others. And each of these institutions that we inhabit, not only our educational institutions, they leave an imprint on us and impact the way we navigate our mental health challenges. I want to begin with the family first. Every person who walks into such an institution carries with them a family blueprint, an invisible set of expectations and emotional patterns learned at home. And while families provide incredible nurturing support, they can also become immense sources of pressure when their aspirations become intertwined with our students' realities and dreams. Amna, for instance, had never been asked what is it that she really wanted from life. Every conversation at home revolved around grades, competitions, and placements. Her identity had become so enmeshed with her external achievements that any challenge or prospective failure felt like an insurmountable threat and a source of tremendous anxiety for her. And now, when we layer onto this family blueprint the realities of an educational system, the second institutional system that we experience in our life, our academic institutes support brilliance in many ways, but they often operate with a scarcity mindset. Limited seats, fierce competition, ranking obsession. Inadvertently, we create environments where collaboration feels risky and vulnerability seems dangerous. One of my colleagues once remarked to me, I wonder if my students are gladiators in an arena or learners in a monastery, you know. And that metaphor struck me so strongly. It seemed to capture something so deep and profound about how institutions work and how they impact the mental health of people who inhabit these institutions. Extreme pressure affects everyone in these institutions. For example, in an academic environment, faculty juggle publishing demands, teaching excellence, administrative duties, while also becoming mental health first aid responders for students. The same is true for staff. And we create a cascade of stress intensive processes which flow through the entire ecosystem. And nobody is safe in such a system. Nobody is spared in such a system. All of us work with our mental health issues as we focus on our work, oftentimes putting our personal well-being at the back burner. And then we come to a point where our students are about to convocate and walk into the larger world. Imagine spending your entire life with structured support. Someone tells you when to wake up, what to study, how to spend your time. You have peer groups, you have faculty who are invested in you, you have mentors, you have counselors, and then suddenly you convocate. And now you are into the working world. The third significant institutional system that we experience as individuals, wherein in many organizations, mental health support often begins and ends with one session on employee assistance program and a takeaway brochure, which I think nobody reads eventually. The transition from being a student to a professional isn't just about applying their newly learned skills. We are also required to restructure our personal and psychological support system when we enter into organizations. The sad part is that we expect our young professionals to do this restructuring at precisely the moment when they are gaining financial independence, often for the first time, dealing with relationship pressures and career uncertainties all at once. And sometimes managers do not sense this struggle. They believe that these young people are too sensitive. We manage just fine, so what's the big deal about it? But today's professionals are growing up in a completely different world. Their awareness and their sensitivity isn't a weakness, it is an evolution. People today are demanding something previous generations couldn't even name, much less ask for themselves. Along with this awareness, there is surely an elephant in the room which continues to wag its tail, because awareness does not lead to help seeking. Primarily, three barriers stand out here: stigma, lack of knowledge, and accessibility. Let's begin with the first barrier that stands between the need to seek help and actual help seeking, which is the stigma. Stigma actually operates like a spider's web. It catches you at multiple levels simultaneously. There is the social stigma. What will people think? There's the family related stigma. How will it impact my relationships? There is the professional stigma. How will it impact my career if people come to know that I'm dealing with mental health struggles? Most insidious is the internalized personal stigma, wherein people believe that I should handle this alone or other people have bigger problems. My problems are not that important. And each of these stop people from seeking help, even when help is available close by. Another barrier is the knowledge gap. So while we see people throwing a lot of mental health language around, you ask somebody, they say, I have anxiety, I have depression, I have OCD. But when it comes to actually understanding these issues or their stress responses or to seeking appropriate help, people fall short. There is lack of understanding around how do we go about this. And finally, even when somebody decides to seek help, navigating the system can be overwhelming. Who do I call? How do I afford mental health care? Do I need a coach? Do I need a counselor? Do I need a psychologist? Do I need a psychiatrist? If a person is a first generation college student or is coming from a family with little mental health awareness, navigating this maze can feel confusing and overwhelming at times. So as I conclude what I'm sharing, let me share a few questions that keep me awake at night. One is, how do we create institutions that see mental health not as a problem to be managed, but as a competency to be developed? Another question is, how do we bridge the gap between mental health and workplace realities, which our young adults are inevitably going to face? The third question which comes to me is, how do we harness the collective wisdom of our socio-cultural systems while creating space for individual growth? And lastly, perhaps most importantly, how do we shift from asking what's wrong with this person to asking what has happened to this person? What does our environment need to do? And what does our environment need to become for our people to thrive? My student Amna, by the way, is doing much better. Not because her family changed overnight or her career challenges disappeared, but because she's developing institutional literacy, the ability to understand how systems are shaping her in her life and how she can reshape them in return. And I believe that all of us need to develop mental health literacy and institutional literacy. Not only the professionals associated with the mental health space, but all of us, especially those of us who are the architects of the systems that shape human thriving and human flourishing. Over to you, Vikram.
Thank you so much for those wonderful remarks. And you listed out all the different questions that keep you awake at night. Well, I'm going to give you an advance warning that I'd like you to prepare on how you would answer those questions in the second round. I wanted to just again highlight a few key things that I take away from what you describe, and just again for the audience, frame the fact that student well-being has now become one of the major national policy priorities. The government of India just a few weeks ago in the last fortnight has announced a major national commission to investigate student well-being, and there are notices in newspapers asking people to submit their thoughts and suggestions. So this is a very vital topic, and part of it is, of course, being driven by the news of suicides, in some of the biggest institutions in the country. But of course, that's only a tip of the iceberg. And I think a suicide is not really in and of itself a metric of how bad the mental health situation can be. I think it's the kinds of descriptions that you describe, Kirti, that one must take heed of. I think what you also said is you describe how in institutions students come not as if like they're blank slates. They actually come as fully formed individuals in many ways with sometimes 10 or 15 years of experience in their families and their schools. And of course, these are also very important environments that shape our mental health. So the life course perspective is extremely important. When you encounter somebody in a workplace context or a higher educational institution, one has to recognize there's already a huge difference between all the individuals in the class, because of course each one has a very different story of their lives from the earliest days till the point they enter the class. And that also influences their mental health. I love what you said. I think it's really important, the culture of educational institutions, a change where to quote you, collaboration is risky and vulnerability is dangerous. Of course, you can see how this contributes to feeling isolated, not being able to work with others, but at the same time feeling uncomfortable in disclosing, any kinds of negative feelings that might be perceived as being signs of weakness. So thank you so much, Kirti. We're now going to go to the second round of questions, and I want to just alert the audience as well. Please do. This is a good time for you to be thinking of questions and posting them in the Q&A section of the Zoom window. We will come around to those. We have enough time to do that. So please do make sure you post the questions you want to ask. If you have a particular person you want to ask it to, you can do that. But if you want to have a general question to anyone on the panel, you're also welcome to do that. So following the same order, let me go back to the second round and ask you, Shekhar, from all that you've heard, but most importantly from your leadership experience, for example, at the World Health Organization, what are the kinds of policy frameworks and benchmarks that you think are relevant for our conversation today?
Thank you, Vikram. And as the webinar is going, I'm learning a lot from our co-panelists, and I'll try to respond to some of the questions that have been raised, some of the very important questions. So, coming to the World Health Organization's policy framework, I think again, a limitation, it applies mostly to the organized sector and not so much to the unorganized and informal sector, which obviously does occupy a very large percentage of people in India, but also in many other countries. WHO has taken a very clear stand on mental health at workplace and has actually published a policy brief and some guidelines about what kind of evidence-based interventions could be useful for mental health at workplace. The policy framework is that mental health has to be seen in aggregate, and workplace does play a very large part in the mental health of people. After all, many people, most of us in fact, spend almost half of our waking life at the workplace, whether it's at workplace or at home or wherever else, and that is an important source of positive as well as negative influences on our mental health. And WHO divides these guidelines of evidence-based practice into three parts. One is organizational factors. Second is the kind of training that the organization provides to managers as well as to employees. And third is the individual interventions, which could be needed in those cases where actual individual help is necessary. I should point out here that World Health Organization does not recommend screening programs. And I come back to what Kirti said. There is a lot of stigma, there is a lot of discrimination, and obviously screening, a routine screening will identify some people who need more help, but it will also stigmatize them. So WHO does not recommend a routine screening for people who may have a mental health need at the workplace, which is quite important to highlight, because many organizations actually are doing screening, which can help, but also can be really very much harmful to the people they are screened in. Uh, Coming to very practical things, you talked about benchmarking. I have been involved in two of these endeavors, and I'll just very briefly describe these so that we can be very concrete about how this can be done. One method is that one can put a questionnaire to the employees to say how their mental health is. And many organizations do that. There are some very good and short instruments and questionnaires for that, which assess people's mental health. Some of them include GHQ, PHQ, and other kind of questionnaires, which within a few questions can ask about the mental health of people, and these have been used. There are serious limitations for this kind of surveys because if it started from the workplace, many people hesitate, also because of the stigma, to identify themselves having mental health problems. And obviously, these are very resource intensive to ask each person about their mental health, especially for organizations which are very large, takes a lot of resources. And to anonymize the data to make sure that people are responding honestly is a major burden. So the other method is to actually assess the organization's preparedness about providing a mentally healthy environment, which has been very much used and also for benchmarking. One of the benchmarking attempts is by a financial organization called CCLA based in UK. And for the last 5 years, it has been doing a survey of organizations, the largest organizations in the world, and publishing a global report about how their workplace is providing a mentally healthy environment or not. The four elements that they assess are management commitment and policies, whether they have mental health as one of the policies as a part of their management commitment. Second is governance and the management issues, how they are implementing that policy within the organization. There is the third part, leadership and innovation. Are their leadership committed to mental health? Have they, for example, made a clear leadership statement about mental health being important? And also, in many cases, whether the leadership is talking about their own mental health or not, because talking about one's own mental health remove the stigma in a very big way. So if the CEO is going down to a town hall meeting and saying, the last month has been extremely stressful for me, and I have been actually taking some help from my personal coach, that really works wonders, because then the employees say, okay, if the CEO can do that, maybe we can also do that. And he's able to talk very openly about that. And finally, performance reporting and impact, whether the organization is following up on this on an annual basis. And based on this kind of benchmarking exercise, they have identified 100 organizations, the largest ones in the world, and uh, and published their mentally healthy or not healthy workplace. They've divided all the organizations into 5 tiers. There are only two organizations from India within these largest 100. One is Tata Consultancy Services, and second is HDFC. And unfortunately, both of them are within tier 4 and 5, which means they are not in the top three tiers. Obviously, there are limitations to this kind of exercise, but Indian companies have a lot of catch up to do because, in general, they are not putting mental health as a part of the organization's vision and aims. The second exercise, which I want to refer to, is more specifically for India. And Vikram and I both were involved in this. This was done by Arogya World, an NGO that started a benchmarking exercise for mental health. And again, very similar kind of indicators were used on promoting well-being, on managing stress, the leadership qualities, as well as supporting recovery for people who might have mental health problem. And they have identified big Indian companies, again, in the organized sector, which are doing well or which are not doing well. And this again is an exercise that is ongoing. I would like to, I will provide a link to that, but there are two organizations which are at least trying to become mentally more healthy. One is Wipro, which has a, an initiative called Mitra, and second is Reliance, which has an initiative called Wish. And both are at least attempting. I cannot say how successful they are, but they're attempting at least, and these are both large organizations, to provide a mentally healthy environment within their organization so that they can remove the stigma as much as possible and provide an environment which can be supportive and protective to the employees and organizations' mental health. I come back to the issue of what organizations can do. And I think there are three things which come out very clearly. One is that they can put mental health on the organization's vision and objectives, remove stigma so that people can talk about it, and then provide the kind of help which people might need if they have a mental health problem. And all three are quite important, and organizations which are able to provide that will eventually do well, not only for the mental health of their employees, but actually for their bottom line, because mentally healthy environments within the organization actually make it a more profitable organizations over long term. Back to you, Vikram.
Thank you so much. And this, nicely segues very nicely to my question for Geeta. Shekhar mentioned a lot about a couple of companies that he mentioned by name. Geeta, I just wanted to know from you, what concrete actions from your experience have corporate houses, such as the ones we've heard from Shekhar, taken that have shown positive results in workplace well-being?
Yeah, thanks for that. And I think there's a lot which are in parallel to whatever Shekhar has mentioned. What works is it actually across the board, specifically post-pandemic, is leadership commitment and a direct involvement. In large organizations, if leadership is aligned, as Shekhar mentioned, mental initiatives are more robust and sustaining. Chances also are that policies, processes, and practices become more effective when organizations take it up as an integrated, holistic approach. There are even larger organizations, MNCs, who have global well-being officers. Levers has it. Deloitte has a chief happiness officer for India. EY Global has well-being leads across, in India and abroad. And I think it's under recognized exactly what Shekhar said. What gets measured gets done. Identifying, tracking, measuring data. I'll give you a recent example. One organization, a manager created a dashboard and he started tracking something small called the red zone, where anybody who was crossing 50 hours in a week, they were tracking that within the small team. And then slowly it became viral. And within a month, HR noticed a pattern. It became, it was a quiet protest actually, and it was numbered. So there was no running away from it. And finally, that's when it became a policy. And the leadership introduced a no meetings post 7 p.m. policy. It could be as simple as tracking what are the medical bills that are getting claimed by employees. It tells you a big story in terms of, where are the expenses going. It could be lifestyle diseases. It could be, issues around migraine. It could be around irritable bowel syndrome. And people are getting treated. And if you understand that pattern, there is lots that happens. Mainstreaming, as Shekhar has also mentioned, mental health and well-being as an occupational health and safety aspect. This really works. Just as a physical personal protective equipment, mental health jackets works well. In fact, in 2021 June, I think there is an ISO 45003. It's an occupational health and safety which has opened up. It's a ISO standard for well-being that was introduced. Unfortunately, there are not much takers. But if it's at a policy level as a directive, because we have to work on multiple fronts, this is basically a guideline for managing psychosocial risk. And it helps manage psychological health, safety risk. And this is already a framework which is already there. And I think if organizations pick it up, it's a great way of integrating it. I think down the line, first aid responders, which is mental health first aiders, creating a groundswell of people, operational, individuals, managers who are trained to provide the initial support, basically understanding if somebody is experiencing a mental health problem. And these are similar to how traditional first aiders provide assistance for physical injuries. They offer help and guidance. That first aid is extremely, extremely important. And then helping them connect to the actual health professionals who can what's not working is mere lip service. That's a continuous challenge. And I saw some questions on the chat saying, how is it that it doesn't work? Because it is not a strategic priority. Business comes first. Unfortunately, these are short-term, outlooks that most organizations have. Despite increasing awareness of mental health, there is a band-aid ambulance service kind of an approach. So you're just fixing the symptom, not really looking at the broad problem. AI is a great opportunity, but also AI has to be used very judiciously because AI cannot replace human intelligence. There is a discrimination, a discretion. There is this ethical boundary that AI cannot navigate. So while it's a great source of resources, a quick go-to, but understanding, recognizing imminent risk, taking that person, alerting the loved ones, doing what is required in that emergency moment. I think for that we definitely need more feet on the ground. So, having said that, I think the whole aspect is clearly the first principles, which is mental health awareness in organizations, process and building competence, access to mental health support services, mental health first aiders. India is doing a great work across our country, and they are using, this whole thing of actually enabling more and more people to talk and normalize the stigma and shame. A mindfully healthy culture, and as everyone talks about, it starts from the top, leadership as a catalyst. For gig workers, it's a little tougher, and I will admit it, there is very little. But it could include developing integrated mental health tools and resources. I think providing financial planning, because their entire stress, a huge amount of stress, is coming from the uncertainty of their income. Establishing fair and transparent platform, and I think this is a government policy, that last mile connectivity, right, including to what Mirai talked about, the unorganized sector, advocating for labor regulations that provide better social security and benefits for gig and the unorganized sector. And I think that's very key.
Thank you so much, Geeta. In fact, that again segues so nicely to Mirai. I mean, you've heard all the much of the discussion so far has really focused on the organized and particularly the corporate sector. Let's flip to this completely different informal sector that you work in, and tell us about the kinds of interventions from your experience could help those women access support and improve their mental health.
Sure. Thanks a lot, Vikram. I think there are things that need to be done at both macro and micro level. I would say one of the biggest interventions, mental health interventions we could do is to provide work to the vast workforce of our country. That is what we hear all the time. Give us work, any work, so that we have some income and we can come out of poverty. So it's both providing employment, something that not just India, but many countries struggle with, but also protecting employment. Just to give you one quick example, street vendors are regularly harassed by the municipal authorities and the police. They confiscate their goods. It took us 40 years to get a law into the Indian Parliament. But with that one law, there's been in many cities, not everywhere, it's a work in progress, but their livelihoods have been protected because the directive of the law is that they cannot be moved unless there's alternative employment and proper arrangements being made. So I think work, and as Dr. Saxena said, work is very much a part of the identity of all citizens of our country. Having said that, I think what I've seen in my years working with informal workers is the importance of solidarity organizations and what I would call horizontal solidarity organizations, in our case, building the sisterhood. And back to Dr. Saxena, who pointed out to me many moons ago that, entirely what we are doing is a mental health intervention. Never thought of it that way. And just as part of the solidarity organization, just small interventions. For example, we begin our day with all faith prayer. It centers us, it brings us all together, it's inclusive, and it gives a sense of sort of peace and yoga as well, and singing together. Those are things that are all which our sisters report really help them to leave all the baggage of what they are struggling with at home when they come to the workplace. So, solidarity organizations, and once we have these solidarity organizations, almost like a cup, then there are all sorts of possibilities. One is what Geeta already mentioned, which is creating a cadre of frontline workers, rather on the lines of the TB dots workers. We call them in our language agevans. You'd understand that, Vikram. It means those who are local leaders, and in our case, women leaders, who are then trained not just to listen to sisters and their families, the local community, but also to recognize early signs and symptoms for referral, also create awareness, because there's such a huge sociocultural gap in our country. Some of us would not be listened to, but someone who's embedded in their communities, who's with them night and day, who stands by them all the time, they're more likely to listen to them than to some of us. So, awareness. Another intervention that we've tried is what we call Seva Shakti Kendras. These are sort of empowerment centers, information hubs, but also safe spaces where women individually or collectively can come and share and speak and vent, which is very much required, we find. And also, they're linked to the various government services and entitlements. So at least they get that kind of support. Then, of course, childcare, which we've spoken about a lot, and other care responsibilities. I mean, one of the things we're doing is advocating for universal childcare. If there's one thing we want to do for women, I mean, in all our studies, women have said that this one intervention gives them peace of mind. So I think this is really important. Also, creating, based on our experience of organizing workers, creating groups of adolescents, girls and boys and young people, where there's peer support, talking to the parents, breaking the stigma, things that other people have said. So I won't repeat those. And finally, I think, although Dr. Saxena, you very much said that there shouldn't be screening, but there is screening for non-communicable diseases in our country now, right at the grassroots level. So whether that could be used as an opportunity to identify those who need high levels of care or some kind of support. But I think one of the biggest problems we find is where to take people. Where do we go if we find someone who needs a higher level of support and care? The referral hospitals are far away. The mental hospitals are far away. The large hospitals, tertiary care, are far away. So what can we do? Maybe telemedicine and so on and so forth. So there's a lot we can do. I painted rather a sobering picture in the beginning, but that is the reality. But there's also much that we can do together.
Yeah, well, thank you, Mirai. That's exactly right. And I want to just end this round of questions, and then we'll have a few minutes for the audience to get in. And this is for Kirti. Kirti, when you ended your remarks in the previous round, you listed so many different barriers. And I'm hoping you came prepared with sharing with us some of the ways in which your educational institution, more broadly, other institutions can strengthen well-being systems for students.
I'll try to keep it short, Vikram, because many of the things that are helpful have already been referred to by my co-panelists. So I'll try to be brief in my remarks. I want to begin with another story of another student, and I'll call him Arjun this time. And Arjun came to me not because he was struggling, but because he had a unique request. And he said that I want to learn how to be mentally healthy at work before I even start working. I've seen my seniors burn out within a year of graduation. I don't want that to happen to me. For me, Arjun's ask was something remarkable because it demonstrated a shift from reactive crisis management into a proactive wellness building. His desire actually, focused on the question that we have been grappling with. How do we transform our institutions from places that merely respond to crisis into spaces for enhancing psychological resilience and well-being, right? Essentially, we need to build systems that build people and not damage them. And that, I think, is very, very important. When we think of strengthening well-being systems, most of us start with the wrong question. We ask, how do we fix mental health problems in our institutions? Rather, we should be asking, how do we design environments that make problems less likely and healing more accessible to each person in our environment, right? Wellness cannot be an add-on. It must be integrated into any institution's DNA. This means simply organizing counseling services or organizing seminars, webinars, workshops is not enough. The job is not done with only these initiatives. We need a more integrated approach, reducing friction in accessing help, reducing stigma around mental health concerns, making services accessible, harnessing the power of new age systems and technologies, creating redundancy in our systems, creating multiple pathways to approach and get the needed help. If one pathway does not work for a person, they should have access to another pathway. For example, if they do not wish to approach a counselor, there should be a faculty member available, there should be a staff available, there should be a peer available, there should be in-house resources available, there should be resources outside our institutions available to take help without feeling apprehensive about what is going to happen when they are going to take mental health care. We are very fortunate in educational institutions because we have certain superpowers at our disposal, and one of the major superpower that we have is what we call the peer support network group. Peer support creates a strong multiplier effect for us. When we train students to support each other, we don't only expand our reach, we create culture shifts in our organization. We create campus cultures where students graduate not only with degrees, but with deeply ingrained habits of mutual care and support. And these are the habits that they can then take to their organizations and their communities, right? Of course, this cannot happen only by training students alone. We need to train our faculty, we need to train our staff, we need to train every person who's associated with, willing, and able to work in this space, right? Especially when faculty and top leadership and staff get trained in mental health care, and especially when they talk about mental health support, like Dr. Saxena was also mentioning, it sends out a strong message and normalizes help seeking behavior across the institute. And that is extremely valuable. We need to be honest with our students about what they are going to face in their organizations. Toxic managers do exist. Workplace discrimination does happen. Economic uncertainty is real. Pretending otherwise leaves everybody vulnerable. In our context, it helps when the academic curriculum also supports resilience training and well-being, and understanding of well-being. These could happen through lab-based courses, experiential workshop, mindfulness trainings like the kind Ms. Chatterjee spoke about, simulations where students get acquainted with difficult interpersonal and group level scenarios in a safe environment and learn to build inner resilience and their own personal well-being practices. We have seen the impact of this on our students and we have found it really helpful in our context. And lastly, I remember there was a time when in an academic culture, strength meant never asking for help, never disclosing that you were going through something difficult, never showing weakness, always having the right answers. But it is time now to flip that script. In our new scripts, strength should not mean silence. Strength should mean knowing when to ask for help, showing vulnerability when appropriate, being comfortable in saying, I don't know what to do, but let's figure it out. We should celebrate students and any individual who seeks counseling the same way we celebrate those who seek mentoring and coaching. If help seeking becomes normalized and even praised, we are likely to see a dramatic increase in seeking early intervention, reduce stigma, development of institutional cultures which support human flourishing rather than just achievements.
Thank you, Kirti. Thank you so much. So we have 10 minutes, and I wanted to give first of all a chance for Shekhar to respond to a point that Mirai raised. Shekhar. Shekhar? Yeah.
I know that time is passing by, so just a very quick comment to Mirai. I think she made a very important point to say if somebody needs help, where does the person go? Because the next mental health facility could be 500 kilometers away. I think the big answer to that question is let's train people who are non-specialists to be able to provide some basic help. India has health workers, they have doctors, they have nurses, India has ASHA workers. They cannot do everything, but they can do a lot. And that's where training becomes important so that within a short distance and without a stigma, because when a person goes to a psychiatrist, there is a stigma. Without a stigma, people can seek help for common problems like anxiety, like depression, like substance abuse and alcohol problems, and get some basic help. So training non-specialists within health sector and outside is actually extremely useful for providing the kind of care that might be needed. Thanks, Vikram.
Thanks, Mirai. This is great. I wanted to maybe, while you respond to that, also there's a couple of questions that are relevant to this particular point. Well, the one question is from Sunit Yadav, who really asks about the practicality and the relevance of having such kinds of frontline workers or counselors, given the informal sector is so what it is. And so I want you to respond to that, as well as Dr. Derasari has posted a question, which I think is a very provocative one. Is it possible that, working in situations which are mission driven and where there is a solidarity in the form of human connections, such as what you described in Seva, may actually in itself be something that protects or provides support to women, contrasting with working in performance driven and, bottom line driven institutions, which I think is a very provocative idea. So, Mirai.
Okay, I'll be quick because I know there are lots of questions, wonderful questions. So as I already mentioned, my experiences of solidarity organizations, not just Seva, but across continents and in many, many countries, is that these kind of organizations are indeed a really important support group for informal workers. I mean, as I said, they work in fields and forests and in the market. So where are they to go? So the only place that they can go, they can find other people like themselves. They can find people who listen to them. They can find role models. They can also struggle together for regular work and income, for childcare. These can only happen when they come together in solidarity organizations like unions, cooperatives, self-help groups. And happily, our government has also realized that. Our government, the former government, it's been known for many, many years. And this is being actively promoted. But it has to be done so with sensitivity and also with some understanding of what is mental health, what is mental well-being, kinds of things we've been talking about today. And as far as the other question, quickly, our experience is that these frontline workers, who in our Gujarati language we call agivans, local women leaders, are second to none. Look, during COVID, when their families said, don't step out, they defied their families and together they went out, saved people, supported them. They're already doing this for mental health. In fact, with training by Sangat and others. And I think that they're doing really well. And the major issue that they keep bringing up to us is where do we take people when they really need support and they don't have the money for it? So those are tough questions, but it's all a work in progress, I think. And with all of us working together, I feel hopeful.
Thank you. Geeta, there's a couple of questions, but I want to start with one from Vishakha. And she asked the question, and this is again a very challenging one. What is a role that can be played by individual agency to find solutions rather than making wellness depend on external environments? This is a very challenging question because many of you have spoken about how, in fact, that is actually shaping mental health. And there is some tension here between, how much of our effort should be in the social environment and how much of it should be in giving agency to individuals. Obviously, it's not either or, but we want to just hear your thoughts about that.
Yeah, Vikram, I think my co-panelist Kirti did address it. And I think rather than being reactive, I think it is important that we respond. And for that, we definitely need the stigma needs to, the shame and stigma is a collective. I think building community across, I think it's like almost like a foundation where we normalize mental health conversation, remove the stigma so that people are able to proactively seek help even when they see signs and symptoms, very similar to what it is like for a physical health. Just when like you have a fever, you take medicines. What do you do when you're not feeling well and there is a poor mental health? And I think that is a very good starting place where individuals get involved. This whole thing of trust and the sense of community that you're not alone. It is not a position of being weak when you're not feeling good. Is something that actually is it is systemic, it is social, it is familial, and it probably starts even from the family, which is the first unit of society. Let's not jump the gun to community and the organizations, but if there is safe spaces at home, because suicide starts with youth, and if they feel unheard, if they feel there is no space other than not even their family to hear. I think that's a good place to start. So I guess the awareness, there is no other, it is a first principle advocacy, awareness, removing the stigma and shame. That's a good place to start. Creating agency is where that's where it will move, I.
Okay, thank you. Kirti, I wanted to take up a question, which I think is very sensitive. Abhijit Gupta really asks about how the mental health of a student may be affected by the fact that they're different from their peers. And of course, one of the really difficult aspects about the student community is how social stratification that is part of our society is also very visible in institutions. And this is to also do with the number of suicides that we see that are actually related to caste and gender also. So I just wanted to hear your thoughts about how you would advise institutions to address the intersectionality of those social vulnerabilities in their mental health programs. And we have only 3 minutes now, and I wanted to have one final question to Shekhar. Shekhar, if you can just prepare, this is the last question, which is a question that's been asked about, really, it's an anonymous questioner. Why has mental health psychosocial support been such a tough sell to governments and funders? And how do you think, I know it's a huge question, but as to the extent you can address it in a couple of minutes, how can we address that? So a couple of minutes, Kirti, a couple of minutes, Shekhar, and then we're going to close.
So Vikram, one of the things that I've realized over the years is that any institution or organization needs to be extremely mindful and aware of these diversities. Pushing them under the carpet, not acknowledging them, half acknowledging them, paying lip service does not help anybody. So, first of all, we need to step up to the plate and recognize that diversity does exist, it does impact people differently, and give them a space to voice how it is impacting them. That is really, really critical. Secondly, respect for each person, no matter what the struggle is, and no matter which space they are coming from. Less judgment, more openness, more acceptance. The third thing that I think helps is having a relationship based culture in your organization and institution. We have become very transactional over the years. You take any institution, any organization, it is more about outcomes rather than processes and what we are creating at the level of culture and values. And I think that has gone missing from our awareness, that needs to get reintroduced into the interventions that we are working with. And lastly, upholding the trust of any person who approaches and wishes to talk about something.
Thank you, Kirti. Thank you. Oh, sorry.
That's all.
Okay, thank you, Kirti.
You give a faculty space to talk, they will speak.
No. I wish we had another half an hour at least, as there's so many questions that we haven't been able to get to. But the big elephant in the room question is for Shekhar. How do we push the agenda for mental health higher up on the agenda of governments and institutions?
Vikram, I have struggled with this question for much of my professional life, so it's difficult to summarize in a minute. But yes, I think I do agree with the basic tenet of the question that it is a hard sell. And I see two reasons behind that. One is ignorance of policymakers in how common mental health problems are, how they can actually be helped a lot, and what are the returns of that. And there is enough evidence on all these 3 points in scientific literature, but policymakers are somehow less aware of that. So in effect, it's our failure to convince and to inform the policymakers about what can be done and how good and effective that can be, not only for the health of people, but for the overall economy. That progress is being made. All countries agreed to mental health being a public health priority in 2013 within the WHO's Mental Health Action Plan, which is now extended to 2030. All countries agreed to the UN Sustainable Development Goals, including promotion of mental health. And a number of countries, including India, are making good progress, starting from a very low point, but still good progress in putting mental health as a part of the health and development agenda in a big way. A lot more needs to be done, but let's recognize things are moving forward. Back to you, Vikram.
Well, thank you all very much. I'm sorry the last part of the session where it was so rushed, but this is what happens when we have so much to share. It's impossible to summarize the richness of this conversation, but I think the key point I take away is both the diversity of workplaces and the challenges that are both unique as well as generalizable across these workplaces, but also the diversity of solutions that not just focus on one sector or one person, but actually across the system, from the individual to the communities that they find themselves working in, to policies that are implemented in organizations, and very importantly, also to the laws, for example, that govern employment practices in India. So thank you all very much for joining us today. I hope everyone enjoyed the webinar. And once again, thank you very much and have a wonderful rest of your evening.